Hi everyone! Today we will be looking into the world of Chlamydia trachomatis, the bacterium responsible for the most common bacterial STI, chlamydia. Chlamydia trachomatis is a gram-negative, obligate intracellular bacterium. It's unique because it lacks a peptidoglycan cell wall, making it resistant to beta-lactam antibiotics like penicillins and cephalosporins. A key feature of C. trachomatis is its biphasic life cycle. It alternates between two forms, the elementary body, EB, and the reticulate body, RB. The EB is small, infectious, and can survive outside host cells. Once it enters a new cell, it transforms into an RB, which is larger and replicates within the host cell. After replication, RBs revert to EBs and are released to infect new cells. This bacterium spreads through sexual contact and can infect the genitals, rectum, throat, and eyes. If untreated, it may lead to serious complications like pelvic inflammatory disease, PID, infertility and ectopic pregnancy in women, or epididymitis in men. Diagnosing C. trachomatis is challenging because it cannot be cultured on standard agar plates. The gold standard is nucleic acid amplification tests, NAATs, which detect bacterial DNA from urine or swabs with high sensitivity. Other methods include direct fluorescent antibody staining and cell culture in McCoy cells, though the latter is less common due to its complexity. One major challenge is that 70–80% of women and 50% of men are asymptomatic. When symptoms do occur, they might include a burning sensation during urination, abnormal discharge, lower abdominal pain in women, or testicular pain in men. Treatment involves antibiotics effective against intracellular bacteria. Due to its lack of a conventional cell wall, beta-lactam antibiotics are ineffective. First-line treatments are doxycycline, 100 mg twice daily for 7 days, or azithromycin, a single 1g dose, especially used during pregnancy. However, antibiotic resistance is an emerging concern, as some strains show reduced susceptibility to macrolides and tetracyclines. This underscores the importance of accurate diagnosis, appropriate treatment, and strict adherence to prescribed therapies. I hope you found this session informative. For more on microbiology and infectious diseases, don't forget to follow and subscribe. Thanks for tuning in.